When you think about schools in particular and children, where we've seen pediatric hospitalizations actually on the rise amid the spread of this variant, do you think keeping schools open is the right move?
I do. I think so, with the appropriate precautions. I do think that the doctor from Northwestern had it right that if done well, school is a relatively safe environment for kids. Masking, tests, especially during the surge of cases, I think it is very important for kids to be in school, and I think the chance that school becomes an explosive source of new infections is low with precautions.
But explosive new infections is really what we've seen, not in schools specifically, but generally 10 million cases in just a week. Are we reaching a peak of this wave, considering how quickly it is spreading through the population?
I think at a certain point it really has to slow down, and that's probably within a couple of weeks or a few weeks away. And that's, I think, going to be good news. The question is, can we keep hospitalizations down enough during this period so we're not swamping hospitals? Because even though there's a less risk of getting hospitalized with Omicron, it's still a risk. And with so many people infected, you see numbers increasing in the hospital. I heard from some doctors saying it's a lot of patients, but the good news is they're not as sick overall as they were back in the Delta wave.
Dr. Sharfstein, how reliable are tests? You know, I keep talking to people who went to a party with someone who tested negative right before the party, but then on the day after or the day after that, they tested positive, and then all of a sudden everyone at the party's got it. I mean, how much can we rely on these lateral flow tests?
That's a really great question, because in the United States, we have a great faith in testing. We just assume that the test is going to give us the answer, and it's very hard to process the fact that there are cases that the tests will miss. And testing only helps in aggregate. If everybody's testing, then we're going to have fewer overall cases, but that doesn't mean you couldn't get into trouble in a situation just like that in a party. And I think that people have to check their risk tolerance and realize that they're lowering the risk where everybody's getting tested, but they're not eliminating it. And you just have to be judicious about, what you want to do, what's valuable to you, and keeping in mind the limits of the testing.
What's your take, by the way, on flights, on the safety of being inside a giant aluminum tube with a few hundred other people for a few hours? 2 years on, because before this COVID pandemic, I thought everybody gets sick on planes. That's just part of traveling. You get sick. That's why somebody invented airborne and made $1 billion off of it. However, throughout this pandemic, talking to airline executives and engineers, I've come to believe that maybe it is cleaned out air, safer place to be as long as everyone's masked. How do you view it?
Yeah, I mean, I think everything's relative. I mean, compared to just sitting at home and doing nothing, it's going to be riskier. But there is a pretty frequent air exchange. You have the chance to wear a mask. And of course, you have the chance to be vaccinated and boosted. So someone who's vaccinated and boosted and masked in an airplane, that is not a very high risk for sitting there. I think it's pretty low. And again, it boils down to your risk tolerance. People who want to avoid the virus at all costs, no matter what, they're going to be stuck at home. But you can now, and I think as we get to 2022 and we say, look, we're going to go back to living our lives, we're going to figure out a way through this, you have to take calculated risks. And air travel, I think, is reasonable under the circumstances. Now, in the middle of a huge wave of Omicron, I think there's some things that we're going to do differently in our lives. But once that's behind us, I think we're going to see 2022 play out a little differently.